Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon at Vriksh Fertility at HSR and Whitefield, Bengaluru. Underwent an IUI cycle and you're wondering if it has worked or not? Must be having lot of questions like what are the early signs? How will I know? When will I know whether I'm pregnant or not, and if the IUI has worked or not? What if it is negative? What are the reasons for this failure? And what to do next? Today, we are going to discuss in detail about all of this. Now, after an IUI procedure, the most common question which I get asked is, how do I know that it has worked? Now, the 2-week wait period which is there following an IUI procedure till you await the pregnancy result is quite nerve-wracking, mainly because the signs and symptoms can be similar to the pregnancy signs and symptoms. This can be because of the progesterone supplementation which we give you. So, in order to not panic, your focus should be mainly on two things. One is to track your implantation signs like your spotting or your mild abdominal cramping, and second is to know when to do the pregnancy test. What are the early signs that your IUI might have worked? Now remember that some women might experience some signs and symptoms while some do not experience anything at all. Now, what are those early signs and symptoms? Number 1 is mild tenderness or cramping in your abdomen. Number 2 is mild spotting, which can coincide with implantation bleeding or implantation spotting just prior to your periods. Number 3 is breast tenderness or feeling fatigued and tired all the time. Number 4 is early nausea or bloating before you even miss your period. Now remember that these symptoms alone cannot be relied upon, because this can also happen because of the supportive progesterone medication which your doctor has prescribed. Now, when do you start feeling pregnancy symptoms after an IUI procedure? If implantation has happened, pregnancy symptoms may start appearing as early as 6 to 12 weeks after your IUI procedure. But not everyone may feel this. Some women only experience signs and symptoms once they miss their period. The best way to know an answer is by doing a beta hCG blood test 14 days after your IUI treatment. Number 1, mild cramping, usually around 6 to 12 days after your IUI procedure. Number 2, mild spotting. This could be the implantation bleeding which usually arrives before your period date. Number 3, suddenly feeling very exhausted. This could be because of the progesterone supplementation which you've been given or the rise in your progesterone in your body itself. Number 4, breast tenderness. Number 5, the biggest one, which is your missed period. Now remember, though these are the early signs, the only test which can confirm and tell whether you're pregnant or not is your urine pregnancy test. This has to be done once you miss your period.